My name is Imogen Parker. I head up policy at the Ada Lovelace Institute, and we're a research institute based in the UK with the remit to ensure that data and AI work for people and society. Over recent weeks, we've been getting deeply focused into the issues of technological responses to COVID-19, and particularly raising the questions of how we can manage to move out of lockdown into a transition phase. We've recently published a report that explored the legal, the technical, the practical, and the kind of social political issues arising from some of these emerging or proposed technologies, including digital contact tracing, symptom tracking, and digital immunity certification. So today's event and today's angle into that topic is a question that's really been rising up, skyrocketing up the agenda in recent days, which is one around devolution and tech responses to COVID. At the weekend, I think we've seen probably the first major divergence in approach between the four nations, which up until this point have been broadly coordinated. I think we've seen from things like the UK-wide action plan at the start of March, the development of regulation following the Coronavirus Act, and timings and approaches to lockdown. While there have been kind of little tweaks, basically there's clearly been a commitment and a value seen in having a unified UK approach, again, kind of up until last weekend, perhaps. And I think over the weekend, we've started to see some of those tensions perhaps emerging or cracks emerging in where to go next. And whether that's related to the specific intervention from number 10, or whether that's about moving into a transition phase and having to balance risks, having to respond to changing evidence on a daily basis, and whether to respond to the local needs and local populations, whether perhaps we're going to see more divergence going forwards, is something that I think is unknown yet. I think you can see that technical approaches, say with the advent of a contact tracing app, might really sit on a fault line for a unified approach, given we know it's going to need a high level of trust, of uptake, of adherence. It might have implications for policing or for liberty, depending on how it's scoped. And I think the question then of really weighing whether prioritising local needs or a local health context, local testing and tracing, local politics, might be worth the cost and the difficulties related to a loss of coordination. So to help us grapple with some of those questions, we've got three really phenomenal, eminent individuals who are joining me today, and I'm really delighted to introduce them. We've got Dr Angela Daly, who is Senior Lecturer at Strathclyde University, Senior Director at Strathclyde Law School and Co-Director at the Centre for Internet Law and Policy at Strathclyde University. And Angela has advised the Scottish Government on contact tracing apps. We've got Professor Maurice Mulvenna, who is a Professor of Computer Science at Ulster University, and Maurice has also been appointed as an academic advisor to the Scientific and Technical Advisory Cell for COVID-19 pandemic at Northern Ireland's Public Health Agency. And we have Professor Pete Burnap, who is a Professor of Data Science and Cybersecurity at the School of Computer Science and Informatics in Cardiff University, and also a member of the UK's government's AI Council, so has that cross-cutting view as well. So we're really delighted to have them with us today. Thank you for joining us. And I want to start by turning to Maurice. So Northern Ireland, not for the first time, has a border issue to grapple with. Last week, the Northern Ireland Public Health Minister urged for the adoption of a single contact tracing app across the UK and Ireland, but that might not be likely or even possible. I just wondered if you can kick off by laying out the current thinking in Northern Ireland on how they're approaching issues of technology and considering their relationship with the rest of the UK, but also the Republic of Ireland.
Yeah, thank you very much, Imogen, and thanks for the invite. Very much appreciated. I think in Northern Ireland we have, just to set the scene for those of you not familiar with the size and so on, we have a population of 1.8 million. As of earlier today, we had 447 deaths. Obviously, far too many. If we look at that in the overall context against, say, our nearest home country neighbours, such in size, with where Pete is from, with Wales with 3 million, currently with 1,132 deaths. So the number of deaths in each of the devolved administration countries seems to be commensurate with population, and what analysis I've done, rather than population density. So the majority of the deaths have followed the same, sadly, trajectory that we've seen across the rest of the UK and devolved administrations, where an increasing realization of the increased number of deaths, perhaps underreporting in care homes. I think in Northern Ireland, we're just as in the rest of the UK, we're going through this together. I think we're learning about that, and then realizing the importance of PPE and to those carers in those homes, and also to record statistically the information accurately and timely. So I think there's a lot of learning from a lot of departments across the whole of the UK. It's not particular to Northern Ireland. Boris launched his Wednesday's plan, today's plan, on Sunday. In the Northern Ireland administration, the executive have announced a plan as well. The plan in Northern Ireland is a 5-phase plan. It doesn't have any dates on it, and it's a bit like Marmite. Some people think it's a very good idea. Some people think it's a terrible idea. Just for context, Imogen mentioned the border, and that's the other B word here. The Republic of Ireland, or Ireland, has announced a plan with dates. So, for example, 29th of June will be where more or less the lockdown really starts to be lifted. So the risk with the Irish plan is that there is a second wave and they have to recant on their plan. The risk with the Northern Irish plan is that whilst phase 1 sees gentle opening of access to private prayer in churches and garden centres and the like, there's no idea when that's going to be. It could be 6 months away in theory. So that's the backdrop. The technology, the Department of Health has been very speedily off the mark with a well-regarded symptom checking app. Download, 1.8 million people. We're talking about tens of thousands in downloads for that app. And there has been a dashboard in the Northern Ireland Department of Health, and then there's also, because of some issues with the timeliness of that, our own university, Ulster University, and some of our research team in the GE campus developed another dashboard. So in terms of technology that's out there that's usable, there are several dashboards. There's the symptom tracer. And the big question really, what today's about is to use a digital app for contact tracing. We're seeing that the UK model is not yet well understood as to whether it works, both technically with the battery life and so on. So we're all learning about that. In Northern Ireland, I think, and this is me informally reporting, I don't know this to be true, but I think there's a feeling for a development of an app in Northern Ireland for contact tracing. And I don't know if that will come to pass. In the Republic of Ireland, then, there's also a desire to develop a tracing app. It's probably going to follow the Google Android model, with no centralized cloud storage, which is a good thing. Then if we look more broadly across Europe, we see that there's a call from people such as the Pan-European Privacy Preserving Proximity Tracing Group, which is not easy to say, but also from the Commission, a desire for a Pan-European contact tracing app. So you can imagine that what's happening between Dundalk and Newry, between Ireland and Northern Ireland, is also happening in, between Hasselt in Belgium and areas of Eindhoven, for example, in Holland. So there are people who are moving about freely between these borders, and a contact tracing app that only relates to the citizens of one jurisdiction doesn't seem to make sense. I can't see the UK government changing their mind and becoming an app taker from Europe any more than they like to be a rule taker. So Ireland may sign up to some pan-European ideal there, or may go it alone, because obviously the island of Ireland is separated by water from the European mainland. So the issue is really, is there going to be a single app on the island of Ireland? The Executive Health Minister, Minister Swan, has has voiced opinion favourably on such an idea. Whether it will come to pass is not a technical issue, but I think it's really just a political issue. Imogen.
Brilliant. Thank you so much for that great introduction. Now turning to Angela, one area of difference, of course, in Scotland is that they are developing their own web-based tool for NHS Scotland, but I think have indicated that they're also opening to seeing whether NHSX could feed into that or complement that. Can you tell us a bit about the decisions at play, I suppose, in Scotland developing their digital approaches at the moment to managing COVID?
Sure, thanks very much, and thanks very much as well for having me and organising this webinar about the devolved nations responses, because I do think what has been happening in the devolved nations has not been very well documented in a lot of the discussions around digital tools, and particularly the NHSX app. So thanks a lot for doing this. Yeah, and I think just at the outset, while I've been advising the Scottish Government, I'm speaking on my own behalf at the moment. So this is certainly not Scottish Government policy or views. Okay, so yes, I've been following obviously very closely what has been happening here in Scotland. And like Maurice said about the situation in Northern Ireland, there wasn't really much in the way of kind of big divergences in terms of policy on the response to COVID-19 in general, nor on the general situation. I mean, we're experiencing a similar proportion of deaths and cases given the size of the population, which in Scotland is about 5 million. Also, I mean, I suppose spread of population here is maybe somewhat different, certainly to England, but also to Northern Ireland and Wales, in as much as we do have quite a few remote communities. Essentially, the Scottish Islands have been isolated for some time, that ferry crossings will only take residents of the islands and people delivering supplies. So anyway, I mean, the situation in Scotland is somewhat different, but also exhibiting a lot of similarities with the rest of the UK as well. Okay, however, I do think in the last few weeks we've begun to see a divergence in policy in Scotland on the COVID-19 response. So I was just kind of checking through some older documents, and actually I think in late April, the Scottish Government published its own pathway to getting out of lockdown, and some more information about its decision-making processes around lockdown and around the COVID-19 response, sometime before other devolved nations and before the UK government centrally as well. In that paper, I can't actually remember if digital tools were even mentioned or not, but it was a policy from early May, the 4th of May, which is the Scottish Government's, let me just check the correct term, test, trace, isolate and support strategy, which was published on the 4th of May, that started to give us a bit more information about public information anyway, about how the Scottish Government planned to address the virus going forward, and where we saw finally that it revealed it was developing its own web-based digital tool, rather than necessarily adopting the NHSX app. Now, if you do look at that document, and I think it is important to look at the text of the document. Not sure if I can do a screen share easily at the moment, but I think if I can, I will just show it to you. Okay, so this is the important part of the document from the 4th of May. And I think an important aspect of the context here is that there seems to be a bigger emphasis on old school, manual, non-digital, non-sexy, non-techie contact tracing in the Scottish Government's response, and particularly in this strategy, compared to what I perceive anyway as being the response from the UK government overall. So while there is this discussion here about digital tools, we see that the Digital Health and Care Institute is developing a secure web-based tool for the NHS in Scotland, accessible on smartphones or computers. And while there is mention of NHSX, the relationship between NHSX and the Scottish Government's plans is not very clear. In fact, in this document, it seems that the Scottish Government and its agencies have not really been very involved in the development of the NHSX app, and in fact are seeking greater involvement. And it's also not clear how the data from this app will interact with what the Scottish Government terms as the Scottish approach to contact tracing. So I think this really decenters the NHSX app from the core contact tracing strategy of the Scottish Government, which seems to be primarily manual contact tracing, and then perhaps as a complement to that, this digital tool. And I think that is backed up by the fact that since this document was published, there's been very little public information about what the web-based digital tool actually is. In fact, I think no public information. And myself and Open Rights Group Scotland, we co-drafted a letter to the Scottish Government asking for more information about precisely what this web-based digital tool will be, what it will be, what kind of data it will collect, where is the data protection impact assessment, where is the impact assessment from the perspective of other human rights, what data security measures are going to be used, etc., 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 and also more information about the interface between this tool and the NHSX app as well. So I think there's a lot of questions about this that we're waiting for some more clarity on. But I think it's important to note that while we haven't received that clarity yet, the Scottish Government has gone ahead and started to recruit for 2,000 manual contact tracing staff to complement the staff that are already working on that. So I do think that the Scottish Government is being much more cautious around digital tools. The fact it's not wholesale adopting the NHSX app in whatever form that may be, I think is quite important. As you can see in this document, they also, I think, implicitly raise some concerns about the app, about the data that's being used, about public confidence in it as well. So I think there's concern there from the Scottish Government, which I welcome in fact, but there's not a lot of clarity about what it's going to be doing with its own digital tool. And of course, while the lockdown measures still continue in a very strong way in Scotland, of course, this issue around our own border with England, the rest of the UK, the rest of our islands, in fact, as well, given people have family, business connections and so on throughout them. How will our approach in Scotland interface with the NHSX app, with whatever happens in Northern Ireland, and maybe whatever happens in the island of Ireland overall? So still a lot of questions, but I would say there's caution in Scotland about NHSX. We can see that with the policy here. And also I think there's caution with regards to digital tools more generally. We're seeing a lot of old school contact tracing methods being centred in this approach. So I'll leave it there.
Brilliant, thank you so much. Now on to Pete and Wales. Pete, is Wales kind of taking a position on its approach to, well, digital contact tracing or tech and its relationship to the UK more generally, or do you think it's a bit early to tell and actually we're in a kind of watching brief phase?
So certainly from my perspective, you know, again, like Angela, I wouldn't necessarily speak on behalf of the Welsh Government, but my perspective of what's happening at the moment. Well, I think as has been alluded to by both Maurice and Angela, there is a bit of a watching brief, I think, across the board. I don't think it's particularly clear exactly what route is going to be followed. There's still a lot of questions over the NHSX app. So there's a viewpoint on that at the moment. So in terms of the general approach in Wales, so very early on, the Welsh Government set up hubs to bring in and deploy offers of support for help. So for things like the Life Sciences Hub and the Tech Task Force, they've very much been able to harness offers from local industry. Going right back to the start of the sort of breakout, South East Wales in particular was one of the worst hit. It was up there with London, you know, right back at the start. So there was obviously a focus on practicalities there, and in particular in the NHS. So the initial focus was very much focused on responses to practicalities such as uplifting the amount of PPE, moving towards the production of ventilators and that sort of thing. So there was very much an emergency response that was just practical and not so concerned about digital response. Moving on from that, so the SAIL database at Swansea is a big anonymized data set or data store, and some of the data from the Join Zoe app is available there for academic and policy research. So there are people in Wales working on that. Obviously, we're seeing differences now, divergences in the choices around lockdown removal. There's a very clear message in Wales that we are asked to stay at home. Schools will stay shut and don't travel to Wales by any means. But obviously, there's a lot of confusion about that, both in terms of going to work. So we have a very big border with England, right from the south, with people in the sort of South Wales area working in Bristol and vice versa, up to North Wales and Chester, Liverpool, and so on. So there's a lot of confusion around that. So we would expect there to try and be as much as possible convergence on the app and the technologies used to track and trace. But again, it's a bit of a watching brief. And at the moment, I still think it's up in the air as to how much will be technology based, how much will be driven by old school methods, more traditional, you know, phone and track methods as well. One of the issues, of course, in Wales is the advocacy of Welsh language. So anything that comes out through something like the NHSX would have to, bear in mind that the requirement for support for Welsh language. I'm led to believe the Welsh Government are in communication with NHSX and are working on these kinds of things. And other technology-wise, there's been a focus, I suppose, on the practicalities of alleviating the demand on the NHS. So we've just seen the launch of a chatbot app, which is a sort of an AI-driven approach to take some of the strain off the 111 calls to help with go beyond standard diagnosis into sort of a question answering kind of mechanism, which is quite good to see as well. So yeah, I think that's pretty much where we are in Wales.
Great, thank you. And I wanted to ask a follow-up question, Pete, given your role on the AI Council, I just wanted to canvass your views on what sort of collaboration is needed and when to produce the sort of insights that we're going to need to guide future planning and to manage the spread of the virus. And just before you answer that, I should just say now that we're very welcome if people do want to submit questions as well. I will keep an eye on the chat function and pose them to the panelists that we've got. Thanks, Pete.
Definitely, yeah. So just on a bit of background for people listening on the AI Council. So the AI Council advises government on it's really set up in response to the industrial strategy in the AI and data economy. So it's advising on the utility of data, the ethical use of data, and the productive and efficient use of data to support industry. At the moment, obviously, the focus is very much on COVID and the support for NHSX, for the NHS more generally. So we've been trying to get to the bottom of how the NHSX app works. With generally, and not speaking for the entire council, but just my perspective, what I've taken from it, I'm getting an understanding that there's more and more coming out. So the source code is now open and available for people to look at and to inspect. There's still a remaining question over whether this source code is the source code that's used and released when the app is released, but that is there and available for scrutiny at the moment. There's more and more information becoming available about the data flows and what comes off the app and when it comes off the app and what's opt-in and what's opt-out, etc., which is which is all really useful. So I think, yes, the key is going to be collaboration and cooperation. The trick to this, and I think, generally there's some frustration that there isn't more information available right now, but you've got to look at the speed that this is moving at. it's moving so rapidly to get out there, and you know, that's important, because we're starting to see the release of lockdown without the app actually being in place yet. So there's those sorts of issues. You know, we do need to get there quickly, but as with all technology, the danger is if you roll it out too quickly without thinking through the consequences of it, you get issues out the other end. So personally, again, I'm quite confident of the security of it, of the cyber security of it. We've seen a blog being written by Ian Levy, the technical director of the National Cybersecurity Centre. I believe that he wouldn't have written such a thing if he didn't have confidence in it, and I would recommend anyone reading that. It's a really good lay view and overview of how the app works and how and why it's secure. But the question is, what data is coming off it, how is it going to be used, and how will it be used in future?
Thank you. We've got a few questions coming in, and I had one as well around trust in the context of this. We know that for the success of any of these types of technologies, they're going to need to be trusted by residents. And I wondered if panelists could reflect on what they think, what effect they might have on public trust in their local regions, whether having a more unified approach or a more devolved approach might work better for the administrations that you're focused on. Perhaps, Angela, can I come to you first?
Oh, I don't really want to kind of give a very definitive opinion on this, because it's more my opinion rather than something kind of highly researched. But I think my feeling is that there's quite a lot of trust in the Scottish government, particularly now, more so than in the UK-wide government in Scotland. And so I think there's quite a lot of support for measures that are being taken or not taken, as the case may be. But I'll leave it at that.
I can chip in on that if you like as well. So I think the issue with the questions around the distrust of the NHSX app, or apparent distrust, and in comparison with the apparent trust in social media, Facebook, WhatsApp, etc. is the question, I think, leaning towards sort of, well, people use social media apps and that collects all sorts of data and is used in all sorts of ways, whereas this is potentially collecting our data and using it to help us. So, why is there that mismatch? So I think one of the key issues with this is, again, it's because of the speed of which it's working, and there's been a lot of press and media coverage about the app and what it might be doing, what it might not be doing. And part of that is an assumption that it will track your location wherever you go and exactly who you've been in contact with, etc., etc. And I think as information has become more widely available, that clearly isn't the case. There is no expectation that it'll be tracking your exact location or who you've been in contact with. It's quite clear in the new information that this information will be anonymized and will not be tracking exact locations at all. But the issue is, we're now in a position where a lot of other information, which was released before this other information, is now in the public domain. We're now in a respond and repair situation, which is a difficult one. And maybe more information could have been made available earlier, but at the same time, because of the speed that we're working at, that information wasn't always necessarily available earlier. I think we just need strong, clear messages now to come out about what it is and what it's not, and what it's doing and what it isn't doing, and why it's being used and how it's being used, and with very little opportunity for misinterpretation.
Thank you. And Maurice, can we come to you now on trust in Northern Ireland and how that interfaces
for sure.
with the approach taken?
Yeah, taking it more broadly than this actual app, which we don't know for sure is going to be used in the devolved government areas. The NHS is trying to move to a more digital provision of services, and that, I think, is quite broadly a good thing. People can get support in their own homes, whether it's for mental health or for support with people with dementia, with reminiscing, and so on. And we're involved in quite a lot of research at Ulster University in both those areas, and digital interventions for both areas. And those kind of interventions are being provisioned onto the App Store for the Department of Health in Northern Ireland. So there's certainly no pushback from the different organisations supporting, for example, an app for people with dementia. So there's a broad movement towards, as baby boomers age and non-boomers, call them that, come along behind, who are increasingly, digital savvy, that they're happy to use these kind of apps. So the risk is that the UK government screw up that whole agenda over this app. And I think that's a significant risk. And I think they have to be transparent about it. I don't think they're being transparent about it. And I think they're not being open and transparent in the way they're sharing basic data across, and this isn't just the UK, this is across all of the governments and all of Europe. There's no publishing of open data for consumption, for data science purposes and so on. So I don't think they get it, and I think there is this big risk that furore, and it is a righteous distrust if there is a lack of transparency that would result in damaging the whole agenda for digital intervention, digital support for people at home, which can be seen by most people as a good thing if handled properly.
Can I jump in and just add a little bit to this? So while I've spoken and focused on the Scottish Government not adopting the NHS app and developing its own tool, that's not the only data, of course, it's using to tackle the pandemic. And I've been, and also as well with the approach to using manual contact tracers, it was reported in the BBC last week that the idea was to recruit manual contact tracers, but also automate the process as well, or as much of the process as possible. So data and digital aspects are still very present in the Scottish Government response. And I think there's not a huge amount of information publicly available about what all that actually is. There's been a big focus on, well, the focus that there has been on Scotland and COVID-19 digital tools has been around not using the NHS app, developing its own tool. But I think there's a lot more going on that it's not very clear to the public what is actually happening. What data sets are being combined? Is this appropriate? Is data being taken from something that's not really health related and then being used and combined with other data sets? So I think it's very important that all of the administrations are as transparent as possible about what they're actually doing in order to generate more public trust.
Thank you. And then a final question, perhaps. I think there's obviously been kind of concerns and questions raised about perhaps what the UK approach is, or specifically around this app and transparency issues, for example. But would the ideal outcome be continuing a unified approach when it comes to using technology, or are there benefits, if well managed, taking more of a localized approach to being able to flex things to reflect the local levels of trust, the local politics, the local approach to testing, to data? Are there kind of benefits there that perhaps outweigh, or at least need to be weighed against, a unified approach if one could be found that worked for all the devolved administrations? Shall I come to you first, Pete?
Sure, yeah. So I think with all things technology, it's important to identify very clearly up front the purpose of why, what's the technology being used for, and how is it going to help us. So I think, if we're looking at, let's just take the example of contact tracing, we want to be able to do business all around the UK. We want people to be able to move around easily around the UK. And, for that reason, having a borderless approach to a contact tracing app would make sense. Having multiple where they can't interoperate is not going to be particularly helpful in the same way that a unified one would. Added to that, you could also do localized sort of analysis of that kind of thing to support more more nation-based approaches. Having said that, I appreciate that there are sorts of issues, local politics issues as well, that need to be taken into account. But again, it goes back to the purpose of why we have the technology in the first place, is to allow us to move easily across the whole UK. And to do that, it would make sense to have one app, I think.
So so one app to unite us all. I don't think it's going to work on the island of Ireland unless we have an island-based approach. So the big island to our east has, maybe has a unified approach or maybe not. But the island that I'm on right now would have its own unified approach. So that maybe if there is a European initiative that comes forward, we see France talking about June for its app. So if there's a unified thinking at a European level, Commission sponsored, that's taken up by Ireland, that is amenable to the executive in Northern Ireland, then possibly, yes, we could have an Island of Ireland app. Otherwise, Occam's razor would be just install all the apps you need as you cross the borders, whatever, as your battery life dies.
I think in principle, kind of one app would make a lot more sense, and one app in Europe would make a lot more sense than the UK having its own app and the Republic of Ireland having its own app and so on. But what I want to say is that I think we're seeing the politics of devolution, the politics of separatism in Scotland, the politics of unification or not in Ireland also playing a role in this. And I don't say that in a negative way as such, but I do think that we're really seeing an interesting constitutional moment over, in fact, apps and the COVID-19 response. One app would be a better option if, in fact, the app was trusted and worked well and was safe and respected human rights and so on. I think the problem with the NHSX approach has been that even if some of this is concern rather than reality, it's concerns that haven't been properly addressed. And the flailing around at the moment with the NHSX app as well doesn't exactly inspire confidence in the app as being a good kind of and strong policy tool. So I think that explains a lot of, not all, but a lot of why Scotland has taken a different approach. But I do think we're really seeing kind of politics bubbling up as well. Lack of confidence in the UK government, the UK government also playing politics by not wanting to involve itself in pan-European approaches as well. So I think as long as that continues, we're unlikely to have one single app.
That's brilliant. Thank you so much. I'm afraid we're out of time, but that has been really fascinating and I think really shows the importance and value of looking at some of these issues, not as if they are a single UK issue that can be unpicked at one level, but really to think about the localised needs, politics and approaches going on in the devolved nation administration, and also thinking about the UK in the context of other countries and of Europe and of the rest of the world as well. So it just leaves me to thank our three speakers so much for their time and their contributions today. It's hugely appreciated that you've taken the time to do this. This is one of a series of events that we're going to be holding, all of them quite short ones, addressing some of the emerging issues around data, algorithmic processes and technologies. So we will be putting further details up on our Twitter feed and on our website as we firm those events up going forward. And finally, a recording of the webinar and a written summary will be available on our website early next week. So thank you so much for joining us. Yeah, take care. Thanks all.